Hello and welcome to the CDO Magazine series. I'm Jake Dreier with HiLabs, and we are partnering with CDO Magazine, MIT CDO IQ, and the International Society of Chief Data Officers in this series of interviews. I'm here with Roger Jansen, the Chief Innovation and Digital Health Officer at Michigan State University Healthcare. Roger, welcome.
Thanks for having me, Jake.
What are some of the new technologies, the new innovations on the horizon that you are excited about that could make this experience be different from what we had when we were 8? I'd love to hear some of your thoughts and reflections on that.
I mean, I think there's a ton coming out, but again, it's going to come back to, will people get reimbursed to use it, right? And is it going to be affordable? But I mean, there's a few things that are coming out in the market right now that I would love to see take on a quicker uptick than what they currently are. But, there's some wearables that give really, really, really good information. The question is, they tell you what to do with that information. So it's nice that I know I walked 10,000 steps today and maybe I burnt 600 calories. Is that enough? What about from my personal, fitness? If I'm Dwayne "The Rock" Johnson versus, me, I'm pretty sure that's not going to be adequate. So we're still using these generalities in such a way that the data is still, the old saying in medicine is take 2 aspirin and call me in the morning. And the reason we said that is we weren't sure it would work, right? Because, it's such a general statement. You pick up a bottle of Tylenol, it says adults should take 2 of these. And I'm pretty sure Shaquille O'Neal and, somebody who's quite smaller than him aren't the same type of adult, if you will, body type. So I think what we need to find, and what I'm getting excited about in healthcare, is this wave of what is the consumer bringing in from a healthcare perspective. And change doesn't necessarily need to come from the healthcare entity out. It can come from the consumer in. And I think our chances of making that type of innovation and data and capability are potentially greater than bringing the innovation out from the health system to the public. And I think, in some ways, it's going to take somebody outside of the existing infrastructure to think differently. Whether it was Apple who changed the music industry and the photography industry and all these other things, or it was, a Netflix changing how we consumed media. It wasn't an incumbent who made that type of change. And I don't think it's going to be the incumbents bringing that type of change to healthcare. So, I'm excited about what people at Amazon are doing. And I just had a friend go back to Amazon, Aaron Martin, who was the chief digital officer at Providence for a while. And, Aaron's a brilliant guy. But what I love is, while he's brilliant, he's worked inside what I call the beast of healthcare. And now he's going back to a place that actually is not encumbered by some of the things that healthcare is, and some of its culture and some of its traditional thinking. And maybe those experiences combined with the new capabilities of an Amazon can be some of those changers. But I would tell you, within healthcare, I can talk to you about MRIs and all the new imaging capabilities and all these things. But patients, they're usually on the bad end of the draw if that's happening. So what I'm looking at is, how do we utilize consumer health capabilities and technology to drive clinical behavior to change?
How can, and you talked about your friend who's working, he went from the beast of healthcare to a disruptor, right? So I guess, how can people that are in the system work and collaborate with the people that are on the outside trying to disrupt?
So I think it's hard because of all the reasons we've talked about, right? And what they get paid to do and what they don't get paid to do. I also think they're threatened by them. I think they want to be close because they want to know what's going on. They don't, it's the fear of missing out, if you will. And it's also cool to say you're working with Google and Amazon, right? That's where all the cool kids hang out.
Yeah.
But I think the reality is you're going to see moderate collaboration in those areas, because if I'm a Google or an Amazon, I'm not sure what the health system's actually bringing me that is going to help me that much. I've got the world's best programmers. I got some great business minds. I can hire the clinicians that I think can give me the insights that I need. Is it a patient population? Yeah, maybe, but are they really going to give their patients to us? Probably not. So what I would envision is them setting out on their own to set up, just like Amazon is setting up their own clinics, beginning to offer this out to employers, really focusing on the experiential consumer aspects of this. And, to me, um, health systems, healthcare, um, just has to open its doors the way we set it up in this country, and it can make money. Because of that, some of that drive to innovate and do things differently isn't quite there. If I can buy a market, and because of things like certificate of a need, which means you can't open up, MRIs or surgery centers or almost anything else, right? I can keep competition out of my backyard as well. So again, I go back to the innovation in healthcare. If you want to see the adoption of more of these capabilities, needs to come from the innovation of the business model first.
So I think with that, and this is a thread which we've I think bounced around, but I'd love to close on, which is people, as we're talking about this innovation and this disruption, people are ultimately afraid that the technology or the innovation will replace this human element that is important to healthcare.
Yep.
That relationship between a person and their physician is something that is important. And I think any of us that are working know that this will not, technology will not replace this. But what are the ways that we can make sure that stays the same, that this human element of healthcare remains and is a part of the innovation that happens in the industry?
Yeah, I mean, I was trained as a neuropsychologist, and I would see patients and I would do assessments, pre and post op and this and that. AI can do a better job than I can probably. Let me just start with that. What AI can't do is tell that person everything's going to be all right. What AI can't do is empathize with that person in a way that lets them know, here's an experience that I've had with someone else and a story that can relate to them. I think the future of healthcare may see clinicians become more counselor, compassionate, confidant, and less diagnostician. And I think that's okay. We have to let some of that go. And I'm not saying it's ready to happen in 2022, right? But I'd be shocked in the next 10 years or 20 years, let's put it out there, that we weren't seeing, AI and machine learning and computer capabilities are overriding our ability to process information. And the reality is, if a machine can look at a diagnosis and it can scan 50,000 articles immediately to find out what the best treatment is for this type, I'm not capable of that. And I don't want to be, because we're not set up that way. But what I am set up to do is my emotional center, my brain, my amygdala, and in these other areas of our brains that can connect with each other are not going to be replaced anytime soon, as far as I know. Maybe someone's working on that. But I really think there's the human connectivity that is essential to care. And we can't forget, we can talk all we want about the science. We can talk all we want about the digital. We cannot forget the compassion and the care that goes into this field. And I don't think you can replace that with technology anytime soon. And I don't think you can replace the historical significance of a clinician who's worked with people for 30 years, understanding the subtleties and nuances of what that other person is going through and how to help share the information, how to talk to the family about the information, how to direct them on what they can do next. When it comes to a diagnostics perspective, AI may beat the pants off of anything we have, and aren't we all going to be better for it?
Mm-hmm. Roger, that's actually a really wonderful place to close out. I really appreciate you talking today. It's amazing to be able to talk to an innovation thought leader in healthcare, and I love that you ended on this note of emphasizing compassion and care, because I think that's what that needs to be the core of all this. And it's reassuring to know that people that are on the front lines of innovating have that as part of your core.
Absolutely. Wouldn't want to do it without it. And thanks for having me.
Yeah, of course. Thank you, Roger, for joining me today. And for any of you that are listening, thank you for joining us. And please visit cdomagazine.tech for additional interviews. Roger, thank you again.
Have a great day. Thank you.
Bye.